Thank you, Sam. I'm going to jump right into the materials with the table of contents and kind of go through what we're going to cover today. We do have a lot of material. I think it's a good webinar for people that are new to HSAs, are looking for a refresher. We're going to go through kind of all the basic rules and the most important rules, starting with an HSA overview. The first 5 or 10 minutes is going to kind of just set the context for an HSA. I think it is important to understand why we have this investment vehicle and kind of what it's all about. Then we'll talk about how do you establish an HSA, kind of the basics. Then the contributions and distributions. Those are probably where most of the questions fall in HSA areas, so we'll spend a lot of time on that. And we'll finish with a little bit of HSA administration, and I'm going to touch on the Affordable Care Act's impact on the health savings accounts in that point as well. So kind of what is an HSA? Well, it's called consumer-driven health care. It's part of a series of programs to try to put consumers back in control of their health dollars. And this actually, they started in 2004, so they've been around a while. Before they predate the Affordable Care Act. The Affordable Care Act took an entirely different tactic for health savings accounts, or than health savings accounts. And initially that was a little bit of a concern of mine and other people in the industry, kind of how are health savings accounts going to play in this new sandbox that really wasn't designed for health savings accounts at all. And the answer is they're playing very well. So they really fit well for the Affordable Care Act, primarily because they're one of the more affordable types of insurance, and that's part of the Affordable Care Act's goal is to reduce insurance premiums, not necessarily by having people buy high-deductible health plans and HSAs, but that's what's turned out to be the case. But going back again to 2004, the idea was to put consumers in charge of their health care dollars. There was a concern that consumers are kind of removed from the process. They go to the doctor, they show an insurance card, they might pay a copay, which is a form of consumerism, but they really don't pay the full cost of the medical expense. And an HSA is designed so an individual pays for the medical expense. And if they don't pay for it, or if they don't have the medical expense, then they actually save that money for the future. Other acronyms that are used or other types of accounts are healthcare reimbursement accounts, HRAs. You may have heard of these. These are very similar to HSAs. There's a couple key differences, but the big difference is an HRA has to be done through an employer group. Only employers can make contributions to HRAs. It has to be through the employer group, and all the receipts need to be verified as medical expenses. Most financial institutions, most people on this call will not involve themselves with HRAs as far as a deposit account because of those requirements. Flexible spending accounts are similar to an HRA or an HSA, but they're another employer-only plan where the money goes into an account for the employee, but the employer needs to verify receipts. And that's not required for HSAs. And HSAs, because of that, end up as a little different animal. You can see this chart just kind of shows that insurance premiums keep going up year after year after year. There was some hope that the Affordable Care Act would reduce insurance costs. That hasn't happened yet. But that's actually good news for HSAs because high-deductible health plans, as insurance premiums go up, people look for alternatives, and high-deductible health plans and HSAs are a good alternative. So, what is the benefit of a high-deductible health plan and HSA? And I'm going to say that throughout this webinar is that term high-deductible health plan. In order to have an HSA, you have to be covered by what's called a high-deductible health plan. I have a slide coming up that will go through the definition of that, but basically it's a health plan with a high deductible. Then because you have a high deductible, you are allowed to use your HSA to pay for those expenses below the deductible. Because it's high deductible, the premiums are usually cheaper too. Think of buying car insurance. If you get a $250 deductible, that's more expensive than a $500 deductible, or some people, drop their deductibility or drop comprehensive care altogether on a car, and the insurance go even lower. So it's the same idea for health savings. It's an alternative to traditional insurance, and it's been going pretty well. This next slide just kind of shows the growth of it, so you can kind of know you're in a growth market here. There's roughly 7 to 9 million HSAs. The IRS did a study long ago that kind of released that information. They know how many HSAs there are because you have to submit a 5498, but they don't release that information, so people are kind of left to estimate how many there are, but there's a lot of them. There's an estimated $23 billion in HSAs, and average balances are about $2,300. Those numbers vary with different estimates, but it's a nice, healthy account for a lot of reasons. The national deposits are growing. I just went through a number. That just shows a chart. This shows how many people are eligible for HSAs. And, one thing interesting about this, I said there's roughly 7 to 9 million HSAs, but this chart actually shows that as of last year, the beginning of last year, there were 15 million people eligible for HSAs. They might not all be eligible, but most of them probably are. That means roughly half of people that are eligible for HSAs don't open one. That's an opportunity for some growth for financial institutions. So it's something to kind of think about, that there's a lot of people that could really benefit from HSAs that don't open them. Many of them are lower income and probably don't need the tax break and don't have the money, but there's still a lot of people that don't open them that probably should be opening HSAs. Obviously, as the time grows, or maybe it's not obvious, the balances grow in the accounts. So if you can, one thing really good about HSAs from a banker's perspective is that they're sticky deposits. So if you get a member or a customer to sign up, they generally stay, and every year the balances grow and grow and grow, at least on averages. And then there's this question of, does consumer health care work? We've had these things now for 10 years, and I've got actually some kind of older study cited in here, but this week Cigna released a new study. Now, I didn't get it in time to do the slides, but the Cigna study says that people that have consumer-driven health care plans spend 12% less on health care than other people. And if you have chronic illness, and a lot of our health care expense in this nation goes for chronic illness, people are 41% more likely, if they have a high-deductible health plan, to be engaged in a management program for their chronic health condition. So these management programs are a way to deal with a chronic health condition. You're 41% more likely. And then Cigna goes on and on with similar statistics like this. You're much more likely, if you have a high-deductible health plan, to use evidence-based practices rather than just going with what your doctor says. There's a lot of things. And actually, Cigna ends it with a quote. They say, literally millions of American workers are reducing health care expenses by shifting behavior rather than cost through the high-deductible health plans. And I think at a basic level, this makes a lot of sense. Somebody who's paying their own health care expenses is likely to do a better job with the money than somebody who's not paying their own health care expense. It is a debated point. Some people think that, when it comes to health care, people aren't looking at the dollar and cents because they're just trying to save their lives. But the numbers, I think, bear out that, money does matter in health care. This next kind of slide just says illustrates what I said earlier, that really, if you have, we'll talk about the deductibles more, but if you have a $2,000 deductible plan, you're responsible for your first $2,000. So you put the money into the HSA, then really the first $2,000 you face, you have to pay with your HSA. So the HSA comes first, and for many people, that's all you'll ever use because you don't go above that deductible. So you never actually use the insurance. It's just there in case there's a catastrophe. Otherwise, it's not used. If you don't use all your HSA money, you can save it for later. If you do, have that catastrophe, you get hit by a bus, the insurance would kick in after the deductible, and then the insurance would pay from that point forward. I said I'd swing back around to what is a high-deductible health plan, and you're going to get this question a lot in different forms, they don't usually ask it this way, but a customer will ask, am I eligible for an HSA, or what do I need to be eligible for an HSA, or is my insurance plan eligible for an HSA? And the best answer is the quick one is, in order to have an HSA-eligible plan, you have to have a high-deductible health plan. This chart shows the limits. So for 2014, you have to have at least a $1,250 deductible if you're self-only, and you have to have at least a $2,500 deductible for family. That's not that high anymore. A lot of traditional plans have roughly that level of insurance, which is another reason more and more people are starting to have eligibility for HSAs. It used to be, $250 deductible was common. That's not so common anymore, so these numbers are not all that high. In fact, a lot of high-deductible health plans go well above these numbers. These are the minimum in order to legally be a high-deductible health plan.